Hi everyone, this is Dr. Cyntrell, Psych. I'm an adult psychiatrist who focuses on addiction. I help those with psychiatric illnesses and addiction problems find a pathway to recovery. You can follow me at www.facebook.com/drcyntrell Psych. Today I will continue with my theme of pregnancy and substance use. Today I will focus on alcohol use in pregnancy. If you're on with me today, please share with your family and friends so that other people can hear this topic. I will give you guys a few minutes to come in and we can just start the discussion. So alcohol use is common in the U.S. I actually believe it's because of the availability of alcohol. You can find it in liquor stores, you can find it in grocery stores, you can even find it in some coffee shops. I mean, I've actually found it in churches, so it's very available to everyone around. So it's actually kind of been destigmatized that people who have problems with it actually use that reason that it's so available and that other people drink. But do they drink like you? Are they drinking a 6-pack a day? Are they drinking a case a day? Are they passing out? So those are the type of questions you have to ask yourself when you're wondering if you have an alcohol problem. So with the common use of alcohol in the country, pregnancy, and especially in females, can be a problem. And often people ask, well, can I drink occasionally? Can I drink once a day? Can I drink when I go out with my friends? Well, let's back up a little bit. So for men, the daily quantity that they say is 2 drinks per day, and for the week it's 14 drinks, and a drink is 1.5 ounces of alcohol, or which is also equivalent to 1 beer. And for females, it's 1 drink per day. So men have a bit more room to drink more alcohol than females do. But females, especially those in fertile ages, when they're 13 to over 40, they also have to think about, well, am I trying to get pregnant? Am I on birth control? Will I get pregnant anytime soon? And should I continue to drink alcohol during my pregnancy? That's a pretty common question I get sometimes in my clinic. So the simple answer is there is actually no recommended safe amount of consumption of alcohol for a person who's pregnant, because everything you use, everything you take into your body also is taken into the baby's body. So the baby cannot process alcohol the way you process it through your liver. Also, the baby is still developing, so there can be consequences to your consumption on the baby's development. So again, there's no safe amount. Research shows that if you consume alcohol, you can subject your baby and yourself to increased risk of miscarriages, stillbirths, prematurity, and sudden infant death syndrome. So those are the things that can be consequences of consumption. So again, to put it simply, don't drink while you're pregnant, because your baby is also taking that drink and your baby can't process it. Also, your baby will get effects. So what are the effects of babies when they have exposure to alcohol while they're fetus? So we actually have clustered this particular disorder into a syndrome, which is called fetal alcohol spectrum disorder, which is pretty much a cluster of disorders that involves physical and also brain damage. So the baby will have physical problems such as abnormalities of their face, hands, feet, and also they can have brain damage. They can have mental retardation. They can They can be slow to develop, etc. And that can, and in the long run, that can damage their ability to behave properly and also learn as they go on through their life. So, fetal alcohol spectrum disorder is pretty much an environmental exposure to alcohol. The baby will not get it genetically, and he won't inherit it from you in your genes. So, if you expose your child to if you expose your child to alcohol, you also are giving yourself an increased risk for stillbirths, prematurity, miscarriages, and if you are able to not have those things happen to you early on in the pregnancy, your baby will have further issues such as fetal alcohol spectrum disorder. So the baby will then have behavioral and learning problems as they age, and sometimes they can also have physical abnormalities in their childhood. So if you do consume alcohol, you put your baby at risk for that. If you don't have any risk at all for fetal alcohol spectrum disorder. So just don't drink while you're pregnant. You put your baby at risk, and for the baby, it's a lifelong problems they will have to deal with because you chose to drink. So if you find yourself pregnant at any stage, most women don't realize they're pregnant until 4 to 6 weeks during the pregnancy. So if you find yourself pregnant, just stop drinking. If you can't stop, get help. So how do you get help? Well, you can talk to your OB-GYN. If you have a psychiatrist, talk to your psychiatrist, and then they can come up with a plan for you if you do have a problem with stopping your use. So let's just go broadly over what can be a plan or treatment options. It really depends on how much alcohol you consume and how much of a problem you have. Maybe it will be a medical detox, if that's necessary. Or we can put you inpatient for a little bit, and then you can get treatment for that. We can also help you with education. We can get you to stop drinking. You can come in. We can discuss the issues surrounding alcohol and why your use so frequent. Do you have problems with life skills? Do you have problems with coping? So those are things that we can address in education and counseling. Another thing we can do is offer you to go to 12-step programs, which have been very helpful for people who have substance use disorder. So those are the things that will be the treatment plan for a person who is pregnant, a woman, a female who is pregnant, and also have issues with alcohol. So again, there's no safe amount. You put your baby at risk for fetal alcohol syndrome disorder, and that risk will be lifelong for your child. Your child will possibly have physical defects and also behavioral issues and learning problems. So if you're pregnant, if you find out you're pregnant, just stop drinking. And if you can't stop drinking, get help by talking to your providers. Okay, so this is Dr. Cyntrell, Psych. This is another topic, alcohol use and pregnancy. Please share with your friends and family so that they can also have the information at their disposal. You can follow me on www.facebook.com/Dr. Cyntrell Psych for further topics concerning psychiatric illness and alcohol use. Psychiatric illness and addiction. Thank you for your time. I look forward to seeing you next time. Bye-bye.